sing the Rotary prayer song. Is my old for me to sleep we pray that into the ark to spread his righteous name. Amen. Fellow Rotarians, shall we recite the four-way test of the things? The four-way test of the things we think, say, and do. 1, is it the truth? 2, is it fair to all concerned? 3, will it build goodwill and better friendship? 4, will it be beneficial to all concerned? Fellow Rotarians, shall we abide by the four-way test in all our life endeavors? Shall we drink a toast to the Republic of Ghana? To the Republic of Ghana. Fellow Rotarians, are there any apologies for members? Any apologies? Okay, I think I have not received any apologies yet from any members, so I believe members will join very soon. So I would like to use this opportunity to introduce our guest speaker for tonight. And we are privileged to have with us Dr. Diane Addo-Yobo. She's going to be our guest speaker for tonight. And Dr. Diane is a Ghanaian American doctor practicing in Ghana. She's the CEO of Metropolitan Medical Center Complex located in Dansoman. This hospital was started by her father, Dr. Charles Otin Addo-Yobo, former pediatrician at Capo Hospital in Tema. His hospital focuses mainly in pediatrics, hematology, and corporate care. She is also the founder of Haven, a center within her hospital compound where patients with underlying health concerns can be reviewed by a doctor without fear of acquiring COVID-19 or any other community. Due to the COVID test pandemic, those with chronic conditions and the elderly deterred from like Kolibu for review due to fear of acquiring the disease and accompanying family members for communicable diseases prior to arrival. Both parents and health care workers are provided with PPEs in order to better protect hospital patrons from acquiring any infections while coming for review. A desire to work and educate the public about hematological disorders had been engineered in Ghana, where over 200,000 babies are diagnosed with sickle cell disease every year. Diane was formerly working with bone marrow transplant and comprehensive sickle cell clinic at Ridge Hospital, and she's currently a sickle cell awareness advocate. So, ladies and gentlemen, as you've already heard, our guest speaker has also lived and studied in the United States. And I believe tonight you are really privileged to have a lot of good information that will come from our doctor as she takes the chair very soon. But before we give her the opportunity, I'll ask RP Nat to read the object of Rotary, which is displayed on the screen for us. RP Nat.
Thank you very much, Rotary President. The object of Rotary. The object of Rotary is to encourage and foster the ideal of service as the basis of worthy enterprise, and in particular to encourage and foster: 1, the development of acquaintance as an opportunity for service; 2, high ethical standards in business and professional; the recognition of the usefulness of all useful occupation, and the dignifying of each Rotarian's occupation as an opportunity to serve society. The application of the ideal of service in each Rotarian's personal, business, and community lives. And the last but not the least, the advancement of the international understanding, goodwill, and peace through a world fellowship of business and professional persons united in the ideal of service. Rotarian presidents, fellow Rotarians, and guests, the object of Rotary.
Thank you, RP Nat, for taking us through the object of Rotary. So without wasting my time, I will invite our guest speaker for tonight to take the floor as she delivers her lecture tonight. So Dr. Diane, your audience are ready to listen to you.
Great, thank you. Please, can you hear me well? Can you hear me?
Yes, we can.
Yeah, we can hear you.
Okay, great, very good. It says only hosts can screen share at this meeting. Can you please give me authorization? Make me a co-host. I have some slides. Pardon? Hello?
All right.
Hello?
Yes, we can hear you.
Yes, but please, I want to share what's on my screen. Great, thank you. Right, it just went off. Okay, can you see what's on my screen? Okay, then, you know what? I WhatsApped you my PowerPoint slides. Can you pull it up? Do you see my slides?
Okay, please try and share your screen again.
Okay. Okay, it went away again. Let me try. Okay, please, I sent you some slides. Do you see it?
Yes, I saw it's on WhatsApp.
Yes, please. If you can open it, I can present you. You display it then. Oh wait.
It's on my phone, and
You can try
I don't
and
have it
share
on.
Rotary.
Okay.
Yeah, now we can see you.
Now you see me. Oh, good, good. Okay, let me do it like this. Great. This is perfect. Okay. Great. I am Rotarian Dr. Diane Addo-Yobo, CEO of Metropolitan Medical Center Complex, and I would like to present to you neonatal jaundice. A quick outline of my presentation. I'll first go through the outline, the definition of jaundice, the statistics of neonatal jaundice, the symptoms, what to look out for if you suspect your child has jaundice, types of jaundice, how jaundice develops, the causes of jaundice according to age, the risk factors for jaundice, and the complications. Jaundice. First of all, a neonate. A neonate is a newborn baby within the first 28 days of life. So we're talking about practically the first month of a baby's life. And neonatal jaundice is the yellowish discoloration of the newborn's eyes and skin caused by excessive amounts of bilirubin in the blood. I'll go into more details about what bilirubin is and how it gets in the blood. However, there are two main types we look at for neonatal jaundice: prehepatic, unconjugated. This just means jaundice that occurs before the liver, and posthepatic jaundice, jaundice that occurs due to a pathology and illness after the liver. A quick review of statistics. 60% of term neonates experience jaundice. Meanwhile, 80% of preterm neonates experience jaundice. So jaundice is relatively common. However, only 18% of neonatal jaundice is actually an illness, a problem that needs medical attention. These are the symptoms of jaundice. The yellowing of the sclera. The sclera is the white portion of the eye. Yellowing of the skin, lethargy. Found the baby very sleepy, not very active. Suddenly the baby doesn't become very active. Poor suckling, hypotonia. You see, babies usually have their arms in a bent position, flexed position. A child suffering from jaundice will feel very weak and floppy, their limbs. But during the later stages of jaundice, if jaundice persists for a long time, the child's body will be very rigid. The child might suffer from seizures, downward deviation of the eyes. It appears that the baby is always seeming to look downwards, and arching of the back. Now, I have a picture of a baby arching his back. Now, if a child has severe jaundice, they might take that position. But also, when children are having abdominal pain, that stretching position also helps them to relieve the pain. So it's not all the time when children take this posture that they have a problem such as jaundice. Now, further explanation into the types of neonatal jaundice. Prehepatic jaundice, jaundice that occurs before the liver. Here we have our red blood cells, prehepatic. Now, a neonate's red blood cells, they are alive, they exist and thrive for only 70 days. Meanwhile, an adult's red blood cells, they live for 120 days. Now, the red blood cells are what give our blood its reddish color. So, since neonates' red blood cells live for a relatively short time, they break down or die off earlier than in adults. Now, when a red blood cell breaks down, there are proteins that are found, writing on the screen. Now, there are proteins that are produced by the liver. It's called albumin. Albumin takes the bilirubin that was broken down, that's from the red blood cell. When red blood cells break down, they release bilirubin. Bilirubin attaches itself to albumin, and albumin goes straight to the liver to be broken down. Now, once the liver breaks down the bilirubin, you won't have an excessive amounts in the blood. The child just urinates out the rest of the bilirubin and there's no discoloration. Now, let's talk about hepatic jaundice, jaundice that can be caused by liver damage. This is relatively rare. It usually occurs as a result of hepatitis, medication, cirrhosis, or tumors. Since children don't really suffer from liver tumors, we hardly see cases like that. And this is, now see over here, this is representing post-hepatic jaundice. If there is a blockage somewhere in the GIT system, the intestinal system, it can cause another type of jaundice. Next slide. Give me 1 minute, it's not making me move my slide. Give me 1 minute. It's not moving. Yeah. That's just another picture of how jaundice develops. The breaking down of red blood cells that cannot be taken to the liver, therefore building up in the bloodstream. Now, we can tell what is causing the jaundice often by looking at the age of the neonates. If the neonate is newborn and it's less than 24 hours of life, the jaundice is most likely caused by fast breakdown of red blood cells, like a red blood cell disorder. Some children inherit abnormal red blood cells from their parents. And also, it can be caused by hemolytic disease caused by rhesus factor. Now, as we know, there are different blood groups, and blood groups are attached to a rhesus factor, or they're in quotes, it tells something about whether they have a plus or a negative, like AB positive, O positive, A negative, things like that. If the mother is rhesus negative, either A negative, B negative, AB negative, or O negative, and their mother is carrying a child, which is A positive, or B positive, or O positive, there's a possibility that the mother might react to the fetus that she's carrying. Similarly, we have ABO incompatibility, meaning that if the mother is blood type O and she's carrying a child that's AB, the mother can actually react antibodies against the baby and causing the red blood cells of the baby to break down. Then there is G6PD. G6PD is an enzymatic defect. Whenever there's stress, oxidative stress in the blood, it causes the red blood cells to break down. Now, what can cause stress in the blood? If, let's say, certain individuals, even adults, have G6PD, if they're around camphor balls, naphthalene balls, see their eyes will be turning yellow and the urine will be turning dark. Same thing can happen with a baby. And congenital infections. If the mother is very sick during the antenatal period, it can cause a bloodborne infection in the neonates. Jaundice, 24 hours to 2 weeks of age. There is physiological jaundice. Now, physiological jaundice is usually not a problem. You see, newborn babies, they might not have enough albumin to take the excess bilirubin to be brought to the liver, simply because the liver is just not well developed yet. They are newborns. So naturally, the child might have a little bit of jaundice. That type of jaundice is not usually treated. We just advise the parents to put the child in the early morning sun. There's breast milk jaundice. It occurs with breastfeeding, and the breast milk jaundice it cannot cause any type of complication. Infections. Child can get an infection after birth, which can cause the red blood cells to break down. Again, we also look at G6PD and ABO incompatibility, but also we take into consideration birth trauma. When some children are born, they really struggle to get through the birth canal. They often have bruises on their hands, feet, or faces, and dehydration. If a child is not fed at regular intervals and a child becomes dehydrated, the red blood cells will break down and cause jaundice. 2 weeks going. More or less, it's a cause of breast milk jaundice. It'll be very mild, just yellowish discoloration of the eyes. You really won't see much change in the skin. Infections throughout, any type of serious infection at any point in the child's life can cause the jaundice. High gastrointestinal obstruction. As shown in the picture, if there's a blockage somewhere in the intestinal tract, mostly the biliary ducts, gallbladder, and such. And pyloric stenosis. Pyloric stenosis is caused when the esophagus, food passes through the esophagus into the stomach. However, there's a ring of muscle that prevents food from the stomach from going back up through the esophagus. If that ring of muscle is too tight, it can cause jaundice. Other contributing factors. Babies born at home. There's certain injections that we give in the hospital to help prevent the baby from getting jaundice. There's vitamin K injections, and sometimes we give vaccines. For antenatal attendance. Some women actually have G6PD and they don't know it. They give birth to children that have it, and they end up getting neonatal jaundice. Delayed reporting of jaundice to healthcare professionals. I think this is one of the biggest risk factors. Because 60% of children get jaundice, it's very common. And it's only 20%, 18 to 20% that needs treatment. So parents just assume jaundice is a normal part of a child's life, and they don't actually report to healthcare professionals. Blood type O mothers, rhesus negative mothers, preterm babies. Preterm babies have poorly developed livers. They're not sophisticated enough to take care of the bilirubin. Therefore, they more often have jaundice. And birth trauma. On the right-hand side, I have a picture of forceps delivery. Child wasn't coming out well, so the doctor had inserted some metal forceps to assist the baby in exiting the womb. And you can see a child in the upper right corner with a lump on his head. That's another birth trauma squeezing through the birth canal. Management of neonatal jaundice. Early sunlight therapy. We encourage mothers to put their children by the window as the early morning sun rises. This helps break down bilirubin into a more soluble form, so it doesn't accumulate in the blood and the babies can just urinate out the soluble form. Medical management. If the child has an infection, they would be given antibiotics. And of course, phototherapy. This is something commonly seen in any NICU ward. You see the young child on the right undergoing phototherapy. And blood exchange transfusion. This is where we take blood out of the baby. We take blood out of the baby and donor blood into the child. Here's a picture right here. We usually use the umbilical cord, where the umbilical cord was attached, to remove the baby's blood. That'll be on the right, and put in donor blood, the blood on the left. There are some side effects, however, of phototherapy. Children often become dehydrated. They often get very dry and cracked skin. This dry and cracked skin can also lead to infections. And there's a delay in mother-child bonding. Complications of neonatal jaundice. Connectorus, which I'll explain more in the next slide. Seizures. Intellectual disability. You find that children, they're usually able to talk at a particular age, say a few words. Children that have severe jaundice, they might not ever develop the ability to talk. They might have trouble walking and developing like other children. Cerebral palsy, a sequelae of intellectual and physical disabilities. And the child might actually die from it. Now, this is a bit more of an explanation on connectorus. Here we have a little child on the left with jaundice, yellow of the eyes, yellow of the skin. Now with connectorus, if there's excess bilirubin in the blood, it leaks into the brain. Usually there is a blood-brain barrier, but neonates don't have a very well-developed blood-brain barrier. So if you have excess amount of bilirubin, it just pours into the brain, causing damage to the child's brain. Long-term complications of jaundice. The child might permanently have a seizure disorder. Even as they grow older and into adulthood, they could still have seizures. Cerebral palsy, an intellectual and physical sequelae where the child does not develop adequately, and intellectual disorders. They might have a lower IQ or might not be able to talk, speak, or carry out certain intellectual activities. Newborn Jaundice Awareness Month. Look out for jaundice in your newborn. Newborn Jaundice Awareness Month, that begins in May. And I would like to ask all my fellow Rotarians, what can we do to prevent the negative effects of jaundice? Thank you so much for your time. You've been a lovely audience. Hello?
Hello.
Yeah,
Hello.
okay, good. You're still there.
Yes.
Okay, I'm trying to bring down my camera again. Okay, I hope you're able to hear me well.
Yes, yes. We're able to hear you well.
Okay, good, good. Please, I'm open.
Thank you.
I'm open to any questions if anybody has any.
Okay. So, fellow Rotarians,
Yeah, hello.
The floor is open for questioning. Please, if you have any question, kindly raise your hand and then I'll give you the opportunity, please.
Okay.
If you have a question, please raise your hand. Yes, Echo, Rotarian Echo. Please go ahead with your question.
Hello, good evening.
Good evening.
Right. Doctor, very nice presentation. Well done.
Thank you.
I just had an observation. On the slides, it appeared to be Caucasian babies. Will that discoloration of the skin also be true for Black babies? And what will be the with sickle cell anemia? Because on this part of Africa, sickle cell anemia is a RBC genetic disorder, is very common here. Does that predispose babies to the neonatal jaundice?
Actually, no. Children who have sickle cell disease, even if you test their blood at a neonatal stage, they won't test positive for sickle cell. Newborn babies have something called fetal hemoglobin.
Right.
So long as that child has fetal hemoglobin, they cannot have a sickle cell crisis. Getting towards 5 months of age, that is when a child might actually have crisis, and you can test the child's blood for sickle cell disease. But as a neonate, you won't be able to get it. You won't be able to get an accurate result.
Okay. All right. All right. Thanks.
Yeah, no problem. Good question.
Rotarians, please, and guessing, retractors, please. Any other question?
May I try again?
Pardon?
Yes, please go ahead.
Okay. You talked about what do you call putting the babies by the window to get the morning sun.
Yeah.
I've heard and I've seen somebody who says their child got a stroke because they were put in the sun. Is there any element of truth in that? Because I'm trying to reconcile the two in my head. It says my sister left my baby in the sun. That's why when now the child has a sun, I don't know what's sunstroke or whatever. I'm not sure what that is called, but the child has some physical deformity, not intellectual, but physical deformity. And I just wanted to know whether there's a conflict there, or I just don't understand.
No, there probably wasn't a heat stroke.
Okay.
You see, let's say putting your baby towards the early morning sun. The early morning sun is not that hot.
Okay.
And heat stroke, it deals with extreme heat, more than 100 degrees Fahrenheit. So how warm was that child? And it couldn't have been that early morning sun. See, that's why we don't say put your child in the sun during the middle of the day.
Okay.
So that child might have had another problem.
Okay.
If you can describe the deformity, maybe I can tell you what problem the child did have.
Well, I mean, I think it was speech and then movement. Speech is a bit, if I remember, this is about maybe 15 years ago I met them. So I remember the child couldn't move, the motor coordination was a bit impaired, and the speech was a bit impaired, wasn't clear at all. They couldn't speak. Yeah.
Now, one important question you might want to ask the parents. When the baby was born, was the baby crying? Did the baby look blue? Some babies have difficulty exiting the birth canal. And when they stay in too long, they can't breathe, they suffocate. And that can actually damage their brain.
Okay.
Yeah, so you might want to know a bit more of the child's birth history. And if the mother was very sick during her pregnancy.
But is there anything more like
cerebral palsy? Because you said it's more like speech and movement, it's more like cerebral palsy. And that can be caused by either 1, severe jaundice, or 2, birth trauma. There must have been something wrong with that obstetric history.
Oh, okay. But is there anything a woman can do during pregnancy to reduce the risk of having a child with neonatal jaundice, maybe diet or something. I'm thinking more of the rural women, not the urbanized, economically empowered women.
Well, I would just say
Hello?
antenatal visits, routine visits to the antenatal clinic.
Okay.
Because a woman might feel like, oh, she's not sick, but maybe she finds herself going to urinate more often than usual, and she gets like a burning sensation when she urinates. When a woman is urinating and they feel a burning sensation, it's actually indicative of a urinary tract infection. So if they go routinely and they report all their health problems, they'll get medication and antibiotics when they need it. So the child won't have any problems. And as for jaundice, it's actually very common. 60% of babies have it. All they need to do is report. I think that's the main problem. Because a lot of women in rural areas.
All right. You know, the reason I asked that is that I've been in some parts of Ghana where you have to travel like miles to get to the closest medical facility. And so I'm just thinking out loud, in that sort of environment, what would be a woman's, how do you call it? First aid, if you will, to help themselves. That was just my thought, you know, because there's some places,
I get you.
The money to get onto the bus to go to the medical center is a major issue. So it's not like, you know, I could easily go every now and so often, you know. So that's actually what just run through my head as you were talking.
Okay. Well, okay, number one thing is that early morning sun. Very important. Secondly, good, proper hygiene. A lot of these women get urinary tract infections because they don't keep themselves neat during their pregnancy. And lastly, perhaps if we equip CHIP centers, we have this sort of gun. It's just like almost like a temperature gun that we use that we can detect bilirubin, high bilirubin levels. So even if you have local women, maybe one person in the village has that so they can check the babies. It's very simple to use, just like a temperature gun.
Okay. Well, so now then your last question, the question you asked at the end of the presentation, perhaps we need to start looking at how we can fund those guns for rural women.
Yeah. So proper training on how to use them, and then have somebody in the community. I'm not sure if, I think most villages, they have CHIP centers, but if they don't have a CHIP center, perhaps designated individuals that can just do a quick screening.
Exactly. So I've answered your question. I'm done. I'll give someone else an opportunity. Thank you, Doc.
Thank you for your question.
All right, thank you. Thank you, Rotary Echo. Please, do you have any more questions for Doctor? Doc, I want to ask a question regarding the data available in Ghana. What percentage of children in Ghana are really affected by this disease? Are there any statistics?
I've been looking around and I find lots of studies, but not on the whole population. It's kind of a public health issue. I'm not able to get direct statistics. I really wanted that for my presentation, but I think there should be more screening, perhaps, or more data collection at CHIP centers.
Because I think even the Ghana Health Service doesn't draw so much attention on this particular ailment. So it looks as if many people are not so much aware of the dangers associated and some of the remedies. But I think, as you said, being a public health, there should be more noise and education on this special subject so that I think the population can be more aware of some of the things they can do, where they can seek help and so on and so forth.
Yeah.
Okay, thank you for everything. We want to take some more questions. Okay, so I think we don't have any more questions for now. So in the absence of any more question, people said, it's been a long time we've seen you. So I want to give you the opportunity to give us the vote of thanks tonight. So people said, I can't lay on mute.
All right, so Rotarian President, fellow Rotarians, guests, and speaker, on behalf of the Rotary Club of Tema Meridian, would like to say a big thank you for the wonderful presentation. This has been a good exposure to us because most of us did not know about this disease and the extent to which it's affecting us, our children at birth. Again, we'd like to thank all other Rotarians and other guests who are on the show with us tonight for joining into our meeting. We'd like to say a big thank you to all Rotarians as well from Tema Meridian. And we hope to meet you next time for our meetings. Thank you very much. Rotarian President, over to you.
Thank you so much, Pipi Sedna, for this wonderful vote of thanks. So, Doc, in fact, Doc is also a Rotarian. She's from Accra, Tesano, and she didn't come alone. She came with some members from her club to support her. So I believe after the meeting, if you want her number and you have some further questions for her, do not hesitate to contact me and I will share her contact with you. And I believe she will be very willing to assist and provide any other answers to questions that we may have. So fellow Rotarians, we will move to the next on the agenda, which is raffle and silly fines. So I will ask our secretary if we can have raffle tonight. Rotarian Blanks.
Hi, Return Philip, how are you? Return President.
Yes.
So let's just go straight into our raffle. If I can share, please.
Okay. So let me make you the co-host. Okay, so you can go ahead to share.
Okay, all right. Hello, good evening, fellow Rotarians and guests. Tonight for our raffle, please, first of all, I would like us to go through the list. I'll just briefly scroll to it. Please, if you can't see your name, just let me know. This is just done for our Rotarians and guests here in Ghana. Hence why I've excluded our guests from outside Ghana. So please do let me know if your name is in. As in, if I've not captured your name, then I'll do so before we proceed. If we are good to go to you, you can let me know. I guess we can proceed.
Yes.
Hello.
Yes, please go ahead. You can proceed, yes.
Okay. All right, so I'll just do a shuffle and then best of luck to everybody.
So this one is it the first winning?
First winning.
All right.
I think I'll go again, and so that somebody else will win. I'll just go again. It comes back to me there then. Okay, return patience. Congratulations. You are the first winner for tonight. And is she here, please? She's still in.
Yes, she's Apostle Patient Ejokumi. I can see her online. She's still online.
Okay, all right. So I'll proceed to the.
Can we?
Sorry.
Can we hear from her if she's online? Patient, are you a Rotarian?
Connected.
Okay. I think maybe we could drop her a message. I don't see her club stated though. So do we take it again or we just proceed?
I wanted to know if she's a guest or a Rotarian, but nevertheless, we will still contact her. So you go ahead with the losing.
Okay, so losing, here we go. P. Enoch. Congratulations, and also sorry for being the losing ticket for tonight. The president will give the direction as to what to do, and then we hope to see you next week. So, Rotary President.
Yeah, Rotary P. Enoch is the president-elect for our Rotary Club. That's the Rotary Club of Tema Meridian. He's the president-elect. So I will pay for him. I will pay for the losing. That's 10 cedis. So I'll send it to the treasurer on his behalf. Yes, because since he's a retractor, I'll do that on your behalf. So P. Enoch, I'm bailing you out. Thank you. So Rotarian Blank, please, can you still go ahead with some donation and fines?
Okay, fellow Rotarians and guests, I rather would like us to do a donation to the club. And for tonight, I want us to do a donation of 10 cedis or above to the club. We will project the account details, the Momo numbers, and then the account numbers for which you can do your transfers to. So please let's all contribute, and thank you for a wonderful meeting, and thanks for joining. Thank you very much.
Thank you, Rotarian Blanks. Thank you so much, Rotarian Blanks. So I would like to acknowledge the presence of Alpinat from Accra Tesano. He didn't come alone, he came with some members from his club. So Alpinat, thank you for joining us. Do you have any special announcement or message from your club for us tonight?
Okay, thank you very much, Return President. I bring you warm greetings from the Rotary Club of Accra Tesano. Come Monday, it's a holiday, the 3rd of May. And we are having our usual holiday health walk. It will be, we would also have an aerobics after the walk, a swimming, tennis, a gym, all at Tesano Sports Club. That's within Tesano enclaves, and you're all invited to share fellowship with us. It starts from 6 in the morning, and the entry fee for the sports club is 15 cedis. Once you pay your 15 cedis, you're entitled to all their facilities there. So I encourage you all to come share fellowship with us. Thank you very much, Rotarian President.
Thank you so much, Alpi. So I believe fellow Rotarians from Tema Meridian, we can, if we are free on Monday, let's try and be at Tesano for this wonderful exercise. And I mean, you have the chance to do any form of exercise you want to. If you want to swim, if you want to play tennis, I believe there'll be a lot of activities on that day. It's something they've been doing, and I can testify to the fact that it's a very interesting activity. So if we are free on Monday, let's try our best to join them and support them. Thank you, Alpinat. So I would ask again Rotarian Blanks to give us attendance report for tonight. Meanwhile, as we wait for Rotarian blanks, I would like to welcome Rotarian Echo. So Rotarian Echo, this is the first time you are fellowship with us. Can you introduce yourself? Tell us a bit from your club.
All right. Well, my name is
President. It's me.
Sorry. Yeah, please, Rotarian Echo, go ahead. I'll come back to Rotarian blanks.
Okay, my name is Eko Otu. I'm a member of Rotary Club of Egbe in Lagos. I used to live in Lagos. I'm back in Accra now for some time. So somebody was kind enough to send me the link, so I joined. So I'm actually club hopping at the moment. I'm just visiting clubs and enjoying Rotary.
Thank you so much. And we are happy to have you fellowship with us tonight. I hope this will not be the last time. We meet every Thursday, so anytime you are available, please feel free to fellowship with us.
Okay. So long as I get the link, I'll just diarize it, and I'll just
kindly drop your number in the message in the chat box, and we will contact you. Yes.
Okay.
And you also have PP Fidel from Nigeria.
Yeah, good evening, everyone. Hello.
Good evening. Good evening, please, we can hear you.
Okay, yeah, my name is Past President Fidel Ebele from RC Obudijiari, Lagos, Nigeria.
Thank you for joining us tonight. Do you have any special announcement from your club?
No, sir.
Can you remind which days you meet so that we can also fellowship with you?
Yes.
Mondays. Okay. What time, please?
Next week, 7 for 7:30. But next week is public holiday, so we won't be meeting. On the 3rd is public holidays in Nigeria. So we'll not meet next week, Monday.
Thank you for joining us. So we will also make our best to join you at the next meeting. Yes, I have your contact, so you can share your link, and then I will share with our members.
No problem, sir. Thank you.
So we also have IPP George from Abuja Ministers Hills, and we had President John who just left.
Okay, President John, yes. PP, in fact,
IPP
George,
George
you had a joint meeting in your club about some 3 weeks ago.
Yes, correct.
Yes. Thank you for joining us tonight.
Yes, good evening, fellow Rotarians, friends and guests. My name is George Hemba, the immediate past president of the Rotary Club of Abuja Ministers Hill, District 9125, Nigeria. Nice fellowship and nice to always be with you. Thank you.
Thank you.
And thank you, PPVJ, for constantly reminding me.
Yes. He has been reminding a lot of people. Thank you so much for that. And in fact, greetings to all members of your club. And we hope to also fellowship with you the next time you have your meeting. So I will ask Rotarian Blacks if you are ready to give us the rest of the attendance report.
Hello, fellow Rotarians, I guess. RP, for tonight, we recorded a peak attendance of 19 and 7 members from our club, with 12 from different clubs. We have our retractor president-elect in our midst as well. And I think you've already gotten in touch with the guys who joined to say thank you. So yes, our peak record is 19. I see 20 now, but this was 19, I'll say. Thank you.
The peak was 23.
23, okay.
In fact, I saw IPP Albert, but I think he just popped in and went out. I wanted to give him the opportunity to tell us some, because it's been a long time we've seen him. Pipi about Ekwaku, but yes, but Pipi Sedina, we are very happy to have you tonight. It's been a long time. Can you tell us where you've been? I know you've been very busy, but I want you to say something to tell us, to us tonight, sorry.
Rotarian President, fellow Rotarians, thank you for the opportunity. Yes, it's been a while, but I was pursuing some studies, and especially on those times that you have meetings, I was always at lectures. So it's unfortunate I couldn't join in the meetings, yes. But we are on a break now, so God willing, you'll be seeing me on every platform going forward. Thank you. Nice meeting everybody again. It's been a while, and I've missed all Rotarians and all Rotary activities. So hello to everybody. Shout out from me. Thanks.
Thank you, Pipi Sedina. In fact, we really missed you. So we are so very happy that you joined us tonight. And I hope that your studies will allow you to join us more often. And to all Rotarians from Tema Meridian, it's been nice having you online tonight. Pipi Alvina, last week you were not with us. Happy to have you tonight.
Yes, the same school issues.
yes, you.
But very soon I'll be done.
Oh yes. It happens sometimes, and you know, whenever the time is available, we always join. So thank you for being around tonight, Pipi Alvina.
Thank you.
Pipi Alvina is our club advisor for Tema Community 25. You know, we have chartered another club. So Tema Meridian has a Rotary club chartered, and you also have a Rotary club chartered. And Pipi Alvina is a club advisor for that club. So it's always a pleasure to have. Do you have any message from them?
No, please.
Okay. So I think if there's anything happening in their club, she'll post it on our platform, and then we will join them and support them. So fellow Rotarians, the meeting has come to an end, and I want to thank you all again for making time to be online tonight. So I will ask Pipi Antoinette. In fact, Pipi Antoinette always joins the meeting. She's always the first person